Okay. All right. Good morning, everybody, and thanks for being here today for our monthly webinar series for the Bench with Bedside Initiative. This is a program that is about patient outreach and engagement and how to interact with patient participants of research. And the idea is for the researchers to collaborate with the patients at the bedside. And what we do with the Bench with Bedside Initiative is we use this platform of outreach and engagement to identify and enroll participants into our research program, but also to continue to engage with them and to work with them along the way and to keep them informed of what we've been doing. And one of the ways that we've been doing this is through this monthly webinar series. So many of you are involved with the Eileen McGeever Breast Cancer Survivorship Program, which again is using the Bench with Bedside Initiative platform to reach out to everybody and to bring you on board. We are many years into it. This program started before COVID, but it sort of gained traction again in 2022 with the sort of reemergence of the program. And so, Audrey, you want to tell us what our number of participants is? We're close to 600 enrolled, right?
Yeah, correct.
Yeah, so thank you all for your support. And this month's webinar is about basically giving you some feedback and some, our opinions on our experiences dealing with cancer. All the panelists today are all cancer survivors. And we also have our co-hosts, Audrey Sagayan and Dayanara Ramirez Ruiz. Audrey is the program administrator for the Eileen McGeever Breast Cancer Survivorship Program. Many of you already know her. And Dayanara is a PhD student, and she's interested in population public health and has been helping us with the webinar series. And they're both going to be co-hosting today, and they're going to be asking us questions, the panelists, and I'm going to let Audrey and Dayanara both introduce the panelists. And just before we start, I'd like to thank the panelists for being here today. You're all good colleagues and friends for many years now, so thank you for joining us. And we are here to tell, right? We are lucky to be here, and that's kind of what we want to talk to you about today. All right, thank you.
Yeah, thank you, Bodour, and welcome everyone, and thank you to our panelists. So I'm going to go ahead and start off just by introducing each of our panelists. So I'll start off with Bodour, so we all know her very well, and I'm just going to go ahead and work through that. So Dr. Salhia is a co-leader of genomic and epigenomic regulation and research, and is overseeing a program and its membership to determine programs' research direction, facilitate collaborations between members and other programs. She is ultimately an associate professor of translational genomics, interim chair of the Department of Translational Genomics. Go ahead, Diana.
I'm going to introduce Dr. Wendy Sitiawan. Dr. Wendy is a Jane and Chris Popovich Chair in Cancer Research and Professor of Population and Public Health Sciences and a Professor of Medicine at the Keck School of Medicine of USC. She is a cancer epidemiologist and a co-leader of the Cancer Epidemiology Program at Norris with over 2 decades of experience in the field. In 2022, her journey took a personal turn when she was diagnosed with breast cancer, becoming a cancer patient herself. This experience has given her a unique perspective, blending her expertise as a cancer researcher with firsthand experience as a survivor. I will also like to introduce Pastor Rhonda Halbert. Pastor Rhonda Halbert is a dedicated community leader, health educator, and advocate with over 2 decades of experience in empowering individuals and communities. She has been a vital force in the Los Angeles Urban League, serving from 1990 to 2015, and continues to guide adult entrepreneurs as a business consultant and mentor. Pastor Rhonda also leads the Biz Institute, a youth entrepreneurship summer camp and year-round training program for teens aged 13 to 18. Pastor Rhonda's commitment to faith and service deepened with her recent role as a chaplain. She continues to serve as a conduit of God's love, offering spiritual guidance, inspiration, and hope to all of those she encounters. Her work is a testament to her belief in choosing life, fostering community spirit, and living with the purpose and resilience. I'll pass it back to you, Audrey.
And last but not least, Mary Alto. She is a breast cancer survivor who received her advocate training from the National Breast Cancer Coalition's Project Lead. She has served as a consumer reviewer for the Congressionally Directed Medical Research Program and currently chairs for the USC Norris Cancer Survivorship Advisory Council, which is a volunteer organization comprised of cancer survivors committed to improving the quality of patient care through advocacy, education, and support for the advancement of cancer research. She managed the Jennifer Diamond Cancer Resource Library, which is the patient education center at USC Norris Comprehensive Cancer Center, as the volunteer library coordinator for 10 years and is the creator organizer of the Patient Perspective series at USC Norris and Keck Medicine of USC, which is an ongoing series of live educational events focused on cancer-related topics from the vantage point of the patient. And with that, thank you all, and we'll jump right into our panelist questions. So as we work through, we're just going to open questions to all the panelists, and then we'll limit them to specific panelists. So this is a question for all of our panelists, and we'll go through each of you with your responses. So please tell us briefly about your experience with cancer, diagnosis, treatment, survivorship, and surveillance. Bodour, if you'd like to open it up.
All right. Yeah. So so I was diagnosed with multiple myeloma. That's the cancer that I basically had to deal with. I discovered it before it was a problem. So that was where I got very lucky. When in 2018, because I chased a finding in blood work that was kind of being dismissed by some of the doctors. I chased a finding, and because I did so, I discovered that I have an early precursor of multiple myeloma. And then I was able to monitor it very closely after that. And within 3 years of being diagnosed with this early form of multiple myeloma, I was diagnosed with sort of more active myeloma. And even then it was very early stages. So I was diagnosed, it was starting to progress in the summer of 2021. And then I started treatment in the winter, like February of 2022. And I was on treatment for 1.5 years, and it was a challenging experience. But yes, so it definitely gave me a completely different perspective. The interesting thing is that I was also a myeloma researcher when I was a postdoctoral fellow at TGen. So I knew a lot about myeloma. I knew a lot about, I knew who the people were. In fact, we do have Barbara Cavanaugh on the call today, who's the founder of the Arizona Myeloma Network. And I've known Barbara for many, many years, probably almost 18 years. So it was just all very bizarre for me to be diagnosed with a cancer that I was studying. I didn't even know what myeloma was when I started doing research in myeloma. It was very new to me. So it's given me definitely a perspective that I didn't have. I didn't want to have this perspective, but I do have it. And I actually appreciate that I have it because I understand the other side of the story very, very much. And it actually helps us build these bridges even more when the researchers, not only become patients, but they know how to interact more with patients and participants in research who have been affected by cancer. It becomes a very powerful thing. And so while I hated having to go through it, I'm ultimately more knowledgeable. I'm more empathetic. I just understand what a cancer patient goes through more firsthand. I know how that feels.
Thank you. And Wendy, we'll go over to you, please.
Sure. So I was diagnosed with breast cancer nearly 2 years ago. It was in October 2022. It was during Breast Cancer Awareness Month. I was 49. Something that's, I like to talk about my diagnosis is not detected through my mammograms. You know, my mammograms always come clean every year. But I know I do have a family history. My sister was diagnosed with breast cancer. My aunt died of breast cancer. But it's actually my rheumatologist who actually asked me to do additional screening. You know, I do have high risk relative to general populations. But, you know, in the past, I just brush it off. I'm like, okay, my mammogram is fine. I'm extremely busy with, you know, doing my work. But, you know, until my doctor, who's a rheumatologist, calculated my lifetime risk, it's really opened up my eyes. I had a 40% of lifetime risk of developing breast cancer. That was the time when I realized, okay, I cannot put off doing this additional screening. And that's how I found out my cancer. So my treatment began with a lumpectomy. Thankfully, it was stage 1. I still went through 20 rounds of radiations. Originally, you know, after all that done, I was doing Lupron and I'm taking aromatase inhibitor, but, you know, because of, you know, I could not tolerate the side effects, you know, they switched me to tamoxifen, which I'm currently taking as part of an ongoing treatment plan. In terms of how this diagnosis, you know, essentially changed my life, it's like, it just changed my perspective. Biggest thing is about my career as a cancer researcher, right? It gave me more personal connection to my work, reminding me that every discovery that we're doing in the lab or in my data analysis, it can actually directly impact lives. So this journey, whole thing with this cancer diagnosis and cancer treatment just reinforced me of the importance of self-care and balance. And now I approach my career with a renewed sense of purpose.
Thank you. And Pastor Rhonda.
Well, good morning. So my journey actually began on 9/11, being my first day at the doctor for what I recognized something was already going on. I just had no idea what it was, but that was my first day at the doctor to be diagnosed with inflammatory breast cancer, stage 3B, age 40, first mammogram. So, and you know, a few months before that, all my friends were going for mammograms and they were saying, "Oh, you're too young. You're too young." Had I waited, I would have not been able to be here with you today. It was an extremely aggressive form of breast cancer. And at that time, only 3% of people were being diagnosed with inflammatory breast cancer. So I actually went through a year and 15 days. And I guess that kind of rolls into how it changed my life is I ended up throwing a party when my treatment was over and it turned into the ministry of Celebrate Life Cancer Ministry. However, I had also been working with, as soon as I was diagnosed, Cynthia Oraduba from the American Cancer Society. We were already on community teams, and she said, "Why don't you come over here and help us with Relay for Life?" And from there, I was always, you know, actively involved with getting to know researchers, getting to know doctors, getting to know other survivors along the way, and just wanting to be there for other people, right? So I I just, you know, just kind of drifted through my treatment. A lot of people say that I have a tendency to take my testimony tends to sound too simple because I didn't have challenges with the medication. I didn't have challenges financially. I didn't have any of the typical challenges that people had, which gave me the opportunity to be an encouragement to other people along the journey. So even when I was in treatment, I was supporting other people. So, you know, when I think about this cancer journey, there are a lot of people that I wouldn't know because of this journey. And there's a lot of people that I would not have been able to help if I wasn't in this journey. So I actually kind of thank God for it. Don't like it, but thank God for it.
Thank you. And Mary.
Hi. My story started really with my mother, who was diagnosed with stage 1 breast cancer in the 1980s. And she, despite her good prognosis and standard of care treatment, passed away 4 years later. And it had a tremendous impact on my family. So I was always very vigilant about, because I thought, well, this could be my future, about my own mammograms, et cetera. And I started getting mammograms when I was in my 30s, actually. So in 2006, I started having something that was very odd, which was itching on my chest wall. I didn't have a lump that I could find. I had a mammogram as usual, as I did every year. It was negative, but I kept having this persistent itching. And it was kind of freaking me out because it was, breast area. And so one day I was dressing in front of my bathroom mirror, and I thought, what is this? And I lifted my arms. And thank God we have 2 armpits. I could compare them. One was slightly more swollen than the other, just a little. I wouldn't have noticed it otherwise if I hadn't been able to compare. And I thought, this is very bad. So I went to my primary care physician, and she examined me, and she felt around my armpit, and neither of us could find a lump. She said, you have a negative mammogram. She said, I know you have a family history, so I'll send you to a community hospital. I live in the San Fernando Valley. And she said, and we'll have somebody take a look. And I said to her, this was a departure for me. I never usually would question a doctor's choice like that. But I said, I have a very bad feeling about this. Could you send me somewhere where I could actually be treated so we could sort of cut to the chase? So she sent me to USC Norris. And I came into the building that day. By the time I left, I had had a definitive diagnosis. The clinician who diagnosed me did a fine needle aspiration on the spot. He said, I can't find a lump either, but here's a kind of suspicious area. Let me go after this. If you'll stick around for a couple hours, we'll give you the findings. And I was so startled. And so it turned out I had stage 3 breast cancer with a 2-centimeter tumor in my breast that no one could feel it, and it didn't show up on a mammogram. So yes, I agree when I hear, Wendy say, you don't necessarily want to trust the modalities 100% that are the screenings. You accept them, and then you remain vigilant anyway. It turned me into an advocate. I had no background whatsoever in healthcare. Science, no, I had no background. And this is back in 2006. I am incredibly grateful every day. I sit on the freeway in traffic, which is kind of not great. And I'm so grateful to sit in traffic every day, every day. It changed me profoundly. I focus pretty much 6-7 days a week on the topic of awareness and educating others and providing a pathway forward, because we know, the 4 of us who are talking today with our cancer diagnoses, how incredibly onerous it is to move forward with a cancer diagnosis. It impacts every aspect of our lives. Our work, the way we think, our relationships, our home life. Suddenly we don't know if we have a future at all. What will that look like? I've been here 18 years since my diagnosis, and I'm hoping I have a lot more years. But the gift really is that I get to interact with people like you all every day, and the patients who come through the system every day. It is such a gift. So I'll stop there.
Thank you so much. Thank you all. So those were our intro questions. So we're going to jump right into our specific questions for each of our panelists. So Dinar, if you could go ahead and jump into the advocacy questions, please.
Yes. So this question is for Mary and Pastor Rhonda. And you guys have talked about it a little bit, but I wanted to ask you if you could elaborate a bit more on what does it mean, or what are the most important elements of patient advocacy for you? You guys have touched a little bit on it in your intro, but if you could elaborate a little bit more.
So
Yes.
for me,
Go ahead.
he
little
tossed
more-
it
yeah,
to me. It's standing in the gap. Patient advocacy from the community perspective is standing in the gap. It's having information that other people don't have and instructing them on how to use it. We've had to provide people with questions of how to talk to their doctor or what questions to ask their doctor. We have simply been on the backside where we are the encouragement. Some people just need to have somebody just gently pushing them from behind, saying, "You can do this." It's, it won't be as long as it's been. That's one of the terms that I love to use, because letting them know that you're halfway there. Don't give up now. Don't turn back now. Um, and being an advocate means that when a person feels like they cannot fight, we help them fight.
I absolutely agree with everything you said. And I think one of the things too, and you made me think about my own experience. When I came into this teaching hospital, and I would do it the same way if I had it to do over, but when I came in, I was absolutely a fish out of water. I didn't have the vocabulary. These people, they're so brilliant. They're talking over my head. And I thought, gosh, I felt like I was speaking English here. And all of a sudden, I'm at such a disadvantage. I didn't know the questions to ask. I didn't know the concepts they were talking about. And they'd nod at me like I knew what they were saying. And I thought, for me to be the best patient, I have to get informed. And so for me, the saving grace was me finding out more about what was going on and interacting better. And what that did is encourage a better relationship with my clinicians. Since then, I've read the research that says that people who have more interactive, trusting, better relationships with their doctors do better, in part because if you trust your doctor, you follow the treatment plan. Right? And you also express your preferences and values, which culturally may not be the same as your doctor, and they need to know that. So if we engage with them better, and that's on us as patients. And so you can't do it unless you're informed. And that's one of the reasons I, for 10 years, managed the patient education center at USC Norris, because I felt that was the crux of it for so many of us. And Pastor Rhonda, I agree with you that you're in the gap, because people need to be kind of nudged forward. Somebody has to kind of be there. They just want to reflect a lot of the time, like, am I thinking straight, or am I crazy right now? They need that mirroring, from someone who's been in the trenches too. It's really, really helpful to look at somebody. I have stage 3 diagnosis, and I've been on the planet 18 more years. I wish I knew me back 18 years ago, because I wanted somebody like that. I wanted somebody who'd made it through the first 5 years, that milestone. So for me, education and actually being there with the patient face to face. And what we do and did in the patient center is we would go online together, and we would together do searches, and then, keep information for the patient that they could use later. And there's a lot out there, but they need direction.
Thank you. And to continue on with this as a follow-up for both of you, what are ways our attendees could also become advocates for breast cancer awareness in the community? And if you could give some examples of people that you've worked with, or some of the examples in your life and what you do, that would also be helpful.
Wow, I have some great doctor friends. Whether they're oncologists or general practitioner, they are helpful, and they have not lost their passion and their reason for becoming a doctor. Because I recognize that we're humans, and ultimately we humanize our role and our position. But the majority of the people that I've met in the cancer world have been continuously passionate about caring for the person, understanding the science, and connecting the two. And so I'm very grateful for that. To also have resources, knowing where to go and when to go there. I kind of agree with the website, but I had to divorce myself from the internet, because I wasn't always knowledgeable enough to stay in my own cancer. So while the information I was receiving was correct information, it may not have been correct for me. And so it was easier for me to, because I'm part of a medical system that has a portal, and I can email my doctor. So I was able to email anything that I found. Because interestingly enough, I remember because part of my challenge, my journey, I had a tram flap reconstructive surgery. And I remember telling the doctor, I heard that if I have that surgery, I won't be able to do sit-ups anymore. He looked me square in my eye. He said, "How many are you doing now?" So, to be able to have doctors with a sense of humor, knowing when to use that language, getting to know you well enough to know that that would not have been an insult. It wasn't an insult to me. Somebody it might have been, but the reality was we need to look at, understanding how to look at the bigger picture and then knowing how to move that needle forward.
Okay, advocacy, because I love this question. Lots of different ways. Like I said, 18 years ago, not a scientist, still not. However, I am a trained layperson. I'm a trained advocate in breast cancer. I actually was trained in Project LEAD, which is the National Breast Cancer Coalition's organization, scientific training. And they train you in all aspects, what an advocate is and how to engage with researchers, et cetera. And what it allowed me to do, getting the training, was to go to Washington, D.C. and serve on panels that allocated funding for breast cancer from around the country, on panels of experts, of 18 people, bioinformatics and oncologists, et cetera. And it really opened my world up. I mean, I got to meet these people. We reviewed as many as 45 grant applications per session. It was a lot of work, but I was just immersed in it. And that actually came about because my oncologist, when I was diagnosed, I suddenly wanted to know everything. And I kept talking to her about the research and I was reading things. And she said, "You should go do this. You should go be an advocate." So for those of you out there who that might sound, you don't have to be a scientist, that might sound appealing. I actually mentored someone else to do this also, because once you actually participate, you can introduce other breast cancer survivors into the program, and they can get trained as well. And then they can go to Washington, D.C. And so a friend of mine, I did that for her, and it's been really amazing, the two of us, doing the same thing. But other ways to advocate, I chair the USC North's Cancer Survivorship Advisory Council. Now, this isn't advocacy per se, but it is the way we do it. It actually is an advisory council that advises from the patient perspective, and based on the patient experience. We advise faculty and staff and clinicians and researchers at the Keck School of Medicine here at USC, and Keck Medicine, Norris Comprehensive Cancer Center, on issues bearing on the quality of care, and also researchers. We interact with researchers who need our perspective on their projects. So it's a tremendous way to advocate. Now, this particular group is not specific to breast cancer. It is very diverse, all kinds of ways, age-wise, diagnosis-wise, culturally. We're a very diverse group, and we're very proud of that fact, as a matter of fact. So there's all kinds of ways. And once again, I really feel that information and education on your particular diagnosis is key. And once you have that information, you can share that, and you will become a touch point, you find, for other people coming to you, trying to find out what you know, because it's very powerful, and it really does enhance your experience and potentially your outcomes.
And also, it'd be great to join a cancer support group, to become, and let them know. Some people don't like to talk a lot when they get to the support group, but let people know that you're interested in being an advocate, and they will direct you. There'll be someone in the group. I have people that call me from other support groups saying, "I want to be more involved," and we see that you're here, there, and everywhere. So we also want to, just communicate and let people know that you're interested in participating.
Yeah, I just want to add to that, actually. Norris the Norris Comprehensive Cancer Center also has a community advisory board. and as part of our community outreach engagement program. And so we really make an effort to engage our community members, and we have like experts in the space who've been, you know, doing this for a very long time and helping patients in the community basically become advocates by giving them an outlet to participate, you know, in having a say. And this is true for in particular, the Department of Defense, like their review panels, they actually invite advocates from the community to review grants, particularly in breast cancer, where the breast cancer community and the advocacy community was very active in implementing policy changes. And so they started becoming part of the review process. And actually, your grant could not get, you know, could be scored you know, in a way by an advocate that would, you know, basically mean that it will not get funded. And so the research community really takes patient advocates seriously. We respect the opinions of patient advocates. We encourage it. There are, Mary or Rhonda, if you don't mind, maybe there are advocacy programs that people can also take, I think, with the NCCN, right? So I think if you can, we will provide you information if you're interested. If you're interested in becoming an advocate, there's training programs for it, and we
Right,
can.
and the one I did is appropriate. Yeah, it's what you're talking about. Yeah.
Yeah, and I think,
out
and
there.
and we know people who were part of our program too, our study, the Bench with Bedside Initiative, that actually went on and took that and have become patient advocates as a result, because they just really got, you know, they understood the importance of participating in that way. And I just want to say one final thing, and we'll move on to the next question. The very fact that somebody participates in research in a way, that's also a form of advocacy. When you're willing to donate your samples to research the way that all of you have, that is really a form of advocacy, because you're doing it not because you're going to benefit from this research directly. Oftentimes you're not. Often, you know, mostly what you're doing is you're providing support to help future people who get cancer. And so, you know, that's not to be underestimated. I mean, that's a really critical part. It's really what drives a lot of this forward. We couldn't do any of this translational research without the generous donation of specimens from all of you. So we're very grateful. All right. Next question, Dainara.
You kind of helped me lead into it. So this one is going to both Bodour and Wendy, both of you as scientists and cancer survivors. Now, how are you also a patient advocate? And I think Bodour kind of touched up a little bit on it, but with your experiences, what do you do to be a patient advocate?
Yeah, I feel like, if I could start, Wendy, I feel like I was a volunteer in health, you know, in the health space for many, as a child, I was doing volunteer work. So I feel like in some ways, without knowing it, I was always an advocate, just by volunteering and from a very young age. And it really started to pick up when I was a graduate student, because I worked for a clinician. Like my PhD mentor was a neurosurgeon. And so he was very involved in, you know, philanthropy, and we did a lot of fundraising for our lab from grateful patients who lost kids, because he was a pediatric neurosurgeon who lost kids to kids who died of brain tumors at the time. And so we were always involved, you know, in community events. And we were advocating hope, right? Like we were advocates of hope through research. And so that's how we were patient advocates, and how I was a patient advocate. It becomes very different once you become a patient yourself. And so while all of that has stayed true, and I've always felt that it was important, even prior to me getting a diagnosis, and as I became an independent researcher and during my postdoctoral fellowship, et cetera, I always went into the community to volunteer and to provide information about cancer to members of the community in various organizations. Susan G. Komen, the wellness community, I think they've changed their name now. the Arizona Myeloma Network. That's how I got to meet Barbara, who's here, and various others. So I've always been an advocate in that way, but from the side of research. And now as a patient myself, my advocacy changes in the sense that I can help people understand the process firsthand. And so I can, guide people to certain things. I can tell them what questions to ask, that they may have not thought about when it came to, doctor's visits. And so you just bring a more personal experience that's not even based on, your professional experience, but purely from a personal experience that you get to merge with your professional knowledge. And I think it becomes a very unique way of helping people.
Yeah, I like to add to what Bodour mentioned. I think as a cancer researcher, right, Bodour, like when we talk to friends and colleagues and, they trust us with what we know about, cancer risk factors. So like before my cancer diagnosis, I always talk about, what lifestyles that's been associated with cancer, things that you can do to reduce your risk. So they like to hear me talk about that, right? But now after, my cancer diagnosis, now I have that unique perspective, not just the research that I've been doing, but also the lived experience, of being a cancer patient. So, now I feel like outside my work, I even make more point to raise awareness about, cancer screening, early detection. I shared my stories widely with all my friends, colleagues, audiences. Just talk about what I mentioned earlier about if you know you're at elevated risk, go ask your doctor. There's additional screening that you need to do. You have history of benign breast disease. What does that mean? If you have family history, if you have dense breasts, talk to your doctor. There are additional screenings that you may need in order for you to be able to detect if there's cancers earlier, which make a huge difference, right? So in terms of as a cancer researcher, my research focus on looking at cancer disparities, looking at racial ethnic differences, socioeconomic, how those, factors influence cancer risk. Now, as a cancer survivor, I understand firsthand, like how diverse experience can actually shape the cancer journey. So for this reason, I use patient advocacy and community outreach to just make sure we reach the underrepresented groups included in my research. Again, emphasizing cancer affects people differently based on factors like race, ethnicity, and socioeconomic status. So I think using advocacy and community outreach is really significant, really important for the type of research that we do.
Yeah, and the social determinants of health, Wendy, that's really important. I just want to make a quick correction. I said Cancer Advisory Board. I actually meant the Norris Community Advisory Board, RCAB. That's what we have. But I think the social determinants of health, it's something that many of us at Norris now are actually very interested in studying. Wendy, we're working together on maybe not social determinants of health, but environmental factors that might be relevant to patient outcomes after cancer treatment. So that's something that, all of you through education and talking to you more about it, we want you to understand the importance of these different social determinants of health and how they shape everybody's, unique journey, right? It really impacts everybody's journey in a different way. And understanding those factors so that we can also identify ways to intervene in terms of like modifying certain behaviors and lifestyles, I think is going to be a really critical component of our cancer studies. And we'll touch on the advocacy, right? Because it's about getting that word out, right? Like part of advocacy is to educate and to bring awareness to new knowledge and help people navigate very complicated lifestyle changes that might be required to, improve their potential for better outcomes.
Okay. So I'll go ahead and segue right into just taking a moment to have you, Bodour, and Wendy just share, as a cancer researcher, what was it like becoming the patient?
Wendy, go ahead.
Oh, okay, sure. So I mentioned earlier, my cancer diagnosis shifted my perspective. The vulnerability that comes with the diagnosis is something that you can never fully understand until you're really in it. So I remember walking through the entrance of the Norris. I've been walking through Norris for the past 20 years as a cancer researcher. But as a patient for the first time, getting that wristband like everyone else, it was really humbling, right? It struck me hard. Like, you're not invisible, this is real. So that's really changed the way, I think about life. So in my research as a cancer epidemiologist, I dealt with numbers and data. I collect thousands and thousands of data from cancer patients. For me, now I realize that every data point in my studies feels deeply personal. So each data point now represents a life, right? It's a family battle with cancer, like my family went through. So it's no longer just data. It's a shared experience. My journey as a patient has given me a profound connection to the people behind those numbers. So then that's transformed the way I approach my work. It's personal now.
Yeah, and for me, I just remember it being a surreal experience, like being told that, well, I wasn't even told. I sort of like kind of figured it out, because I had a lot of issues in terms of like the diagnosis, because it's not an easy disease to catch very early. I found my disease very early, and it was actually being dismissed. And even when it was progressing, I had to actually so here's another question related to, or an answer related to advocacy. I actually had to be my own advocate, right? I had to be my own advocate, and knowledge helped me be my own advocate. So I feel like in some ways I actually diagnosed myself and just got confirmation from doctors. And then as it just became more and more real, I just remember, for me, the day that I was starting my chemo, my first day of chemo, was so scary for me. I was so terrified. I had two friends with me, and who I actually didn't want anybody to come with me. It was really kind of not a good idea, but I'm a bit stubborn that way. But I had two friends who insisted. And so two friends came with me on the day of chemo. And the crazy thing is that my first day at chemo was at the Norris Comprehensive Cancer Center, where I work. And the day hospital is where you get treated. And there's a fish tank for any of you who have been to Norris, right? There's that fish tank that was always there. I would always walk through to go to my lab, through those doors, those glass doors that get you in. And I would walk through, and as I would see all the patients sitting there, with caps on, clearly looking like they're cancer patients. And my heart would always sink. And that was part of my love of being at Norris, is that there was a constant daily reminder of why I was there. Because I got to see it like every day, and my heart would sink every time I see patients walking, and I would walk through that hallway. And it brings chills to me still to think about the day that I was on the other side of that fish tank, sitting in those chairs, waiting to be seen. And it was really very tough. And yeah, like I was like, wow, I'm on the other side. Like I never envisioned that, like, ever, I just never thought I would be on the other side. So yeah, it was really intense for me. So it was surreal. It's still surreal.
Thank you for
Yeah.
sharing. And with that, now being on the other side of having gone through treatment as a survivor, what are some of the changes that you've applied to your life just to limit your own recurrence, and in your experience as a researcher, what you know about cancer?
Do you want me to go first, Bodour?
Sure. Go ahead, Wendy.
So it changed the way I approach life, especially I think when it comes to managing stress. I mean, everybody's stressed, but you know, as a cancer researcher in academia, we're constantly, chasing deadlines, writing grants, publications, managing students, a research group. So it's a lot of stress, right? I mean, but what I realized after my cancer diagnosis is sometimes what once seems very overwhelming and important now can be feels insignificant after you're diagnosed with cancer. So that's what I gained, this new perspective of really what truly matters now for my life, right? One thing that I realized, spending quality time with my family, my friends, it becomes so invaluable, so that's one thing that I really, really realize now since my cancer diagnosis. The other thing that I really learned is about self-care. It's now becoming a priority. Before, I have to finish all my grand deadlines first. I have to finish all my papers first before I actually go to yoga, for example. So it's not just physical, but it's also mental. I now make time to do yoga, to do meditation, which I think help me stay grounded and balanced. So I become much more mindful also in terms of what I eat. I pay closer attention to my diet and the overall well-being. So I think that's the big things that happened to me since my cancer diagnosis.
Yeah, I agree, and I think I'm maybe not as disciplined, Wendy, even though I know this is what I should be doing. I'm not as disciplined, but I think what a cancer diagnosis has done for me is just given me strength. I'm like, I've really gained so much strength. And when hardships come, they still come. Hardships don't stop with cancer, unfortunately. Like still things happen. But it's just kind of like, okay, I've been through a bone marrow transplant. You got something better than this? It's just kind of, it puts it into a perspective, like you were saying, that's for sure, where it's like one of the hardest things that I think all of you here would agree as cancer survivors. I'm assuming most of you here are cancer survivors. Um, but I think it just gives you a strength that you just didn't know you had. And sometimes you don't feel it until after it's over. And you're like, oh my God, I just went through that. And I'm, on the other side of it, and I'm, better for it, and I'm stronger for it. And it just keeps you pushing. I mean, it's a fight for life, right? It really is. And that's there's no bigger challenge when you're fighting for your life. I mean, that's what you're doing. And so it helps you deal with things, or at least for me, it's helped me put, like you said, Wendy, it's like exactly like that. It's helped me put things into perspective. I'm like, when you don't get a grant or when something else happens, it's like, it doesn't feel good, but it's like, this does not define you. So it just, the petty things in life just don't seem as important anymore. And you don't want to put any attention on things that, don't have any impact or significance on the value of your life, or anybody else's life for that matter. But what it's also allowed me to do is just be more passionate about my research and really committed to translational research and bringing the work that we do to the bedside. And that's something that is probably the reason why I haven't had time for a lot of self-care, because I'm like pushing really hard in this space, but self-care is critical. And I'm trying to be better at it. I am actually really working hard on it.
Thank you for sharing.
Thank you
Yeah.
for being real.
Yep. I was just about to allow Mary and Pastor Rhonda to jump in here. And please share any comments that you might have on what Wendy and Bodour shared. But to just come back to the question was, what do you do to limit your own risk of recurrence? And go ahead.
I think that's a very tough question because that's also a very personal question in the sense that when you get cancer and you're on the other side, what people do and think about recurrence is personal. Some people don't want to think about it and they just don't want that in their ethos. And then other people are chronically worried about it. Or maybe it also depends on the type of cancer you have and whatever prognosis your doctor told you that you might have. I mean, if you have stage 1 breast cancer, it's just depends on the statistics, but the statistics don't apply. And also, nobody knows how to prevent recurrence. I have a disease, multiple myeloma, where the risk of recurrence or a relapse is almost guaranteed, right? Like it's like I hated that when doctors would like I'd sit there with the doctors and like you need to collect, stem cells enough for 2 bone marrow. So when it comes back, you have another, you have some more stem cells that are saved for you. And I'm just like, I would get so mad by this. And I'm like, why are you saying when? Like I would even ask them, like, why are you saying when it comes back? Like I believe with the treatment that I had that and with the research that's being done in multiple myeloma that you can cure myeloma now. And at least one of my doctors, I have had many talk to me about this, believes that you can cure myeloma. And I believe it. And I was very lucky because I had access to the best doctors, to the best care, to the right. So I did have an advantageous scenario, and also the knowledge, but I'm following my molecular markers that would indicate if the chance of recurrence is there or not. And um, and so while I do think about it, and especially like as I was 2 years out of treatment, I would be like, okay, now my bone marrow, like the summer's bone marrow biopsy, I was actually nervous about it because I wasn't nervous about the bone marrow biopsy as much right after I was finished the main bulk of my treatment because I'm like, okay, well, I know I got some years here, but like when the more years you are out, at least within the early years, like between like around 5 years, it's kind of like you're nervous because, you know, depending on the cancer, if you hit that threshold of years cancer free, you feel good, but then anything before that, gets a little nerve-wracking, at least for me. And so I was like, okay, what does this bone marrow? Oh my God, I'm so nervous. But it was a great bone marrow. Like it actually showed a trend in the right direction. And, I'm almost completely cancer free. And so, so that makes me feel good. But the truth is nobody knows, and there is no way to prevent it. It's just people know strategies to increase the likelihood that it doesn't come back. But we're not quite there as a field yet where we can prevent recurrence altogether. But as the treatments get better, that is a way of preventing recurrence. In terms of lifestyles, there's less known about what can be done, and it's very personal. The Eileen McGeever Breast Cancer Survivorship Program is actually all about that. What are the lifestyle habits and these social determinants of health together with the biological and molecular features of a person in the survivorship years that may predict a chance of recurrence. But we don't know for sure exactly what lifestyle changes. So for me, the thing that you try to do, and like what Wendy was saying, is living a healthy lifestyle the best you can. Keeping your stress down. Okay, I'm not too good at that. Keeping stress down, eating healthy, exercising, self-care, and also social interaction engagement is actually critical. And again, time with family and friends is really important, and building that community and support around you is actually critical. And there are data that show that people who are socially isolated tend to have worse outcomes for various cancers. So I think it's a multifactorial thing. It's not one thing. It's just, it's a very holistic system. You're whole. You are not one thing. So you have to kind of try to, care for all of the different aspects of your life. And at the end of the day, you just do what you just do what you can do, and then the rest is not up to you.
Yeah.
And I would like to add to that, because I'm not as disciplined as Wendy either. But one of the things is, as we go through the roller coasters of caring for yourself, become aware of when you're off track. Do an evaluation with yourself that says, hey, wait a minute, what's going on here? You were doing so good, self. You're off track, self. What's going on in your world that has gotten you to think in a different direction, that is causing you to eat stuff you know good and well you ought not be eating, that has contributed possibly to your health in the past? Do a self-evaluation that brings you to a place that says, okay, self, me and you, we're back in this. Get back on the horse and let's ride to the sunset.
Thank you.
I agree. I'll just put my 2 cents in. When I was diagnosed, none of us chose this. People don't choose cancer. And so life can feel very out of control. And one of the few things we can control is the way we live. And so, as has been said, some people they want to look the other way. Be my guest, because that's not my style, but I really understand that you may not want to look daily at your cancer situation. But for those of us who want to regain maybe a little sense of empowerment and sense of control, lifestyle changes are really great that way. So the first thing I did, and I don't always say this out loud, but I lost 50 pounds because being overweight I have hormone receptor positive breast cancer, and there really is research that shows that people who are more overweight recur at a greater rate. So I lost 50 pounds. I did change the way I ate quite a bit. And I continue to do that. But the interesting thing is, for me anyway, I'm surrounded daily with healthcare professionals, and I pick their brains about their research. So I know some registered dietitians really well, and the latest research is saying that these spikes in cancers, specific cancers that we're seeing right now, may be very linked to additives in our food. There's a lot of research in that area right now. And there are apps that are great that I'm addicted to, where you can actually, scan barcodes of processed foods, because everything that's processed has a barcode, right? And it will actually break down not only the additives, but the research on the additives for you. So you can just walk through Trader Joe's and do that. I mean, there's a lot of steps you can take to actually that are appealing to some of us, and we just have to find what works for us. And Pastor Rhonda, point well taken about how we ebb and flow with our healthy lifestyle. It's not going to be the same all the time, but find what works for us and makes us feel empowered too, because like I said, we didn't choose this, and if in fact we can find more value in every minute of every day because of this diagnosis, yay for us. And also, if it helps make us easier for us to make healthy food choices or lifestyle choices, yay too, that's a win. So I'm big on taking action to feel better.
Wendy,
you.
did you want to add to that?
Sure. So this is personal experience, right? Specifically is for breast cancer, what I'm right now doing to prevent my own recurrence. So I'm diligent about taking my meds. I make sure I never miss my follow-up appointments with my doctors. Staying on top of my imaging, regular checkups, I think that's key.
Yeah.
In terms of lifestyle, I know this can be hard. I completely cut off alcohol, which is a big shift for me, but the one that I felt was necessary for my health. So I mentioned earlier, I practice yoga now 3 times a week. I make a point to walk almost every evening, So these activities just keep me physically active and also help me manage my stress, which I think important in minimizing the risk of recurrence, at least for my type of cancer.
Yeah, I think the taking the meds, I mean, certainly still on medications, chemo drugs for maintenance like you are, Wendy. And I think just being exactly just being compliant with the, you know, with the things that you're asked to do by your doctor and going to your, I can't, I 100% agree with that. 100% agree with that.
All right. So to close off, this is our final question before we open it up to all the other questions that have either been submitted or to the attendees. What is the thing you carry the most from your experience that impacts your day-to-day personal and or professional journey? So choose to talk on one of the other. I know most people have shared about this, but just kind of to close it all, what is something that you take from your experience in your day-to-day, whether it be personal or professional?
I'll start. I'm gonna say, I think I'm gonna emphasize strength, the amount, strength that it has given me, to basically endure anything. And it's just it gives you a resilience to life, and it also gives you an appreciation, a different kind of appreciation for life and a different kind of meaning. And I think I carry that with me in all aspects of my life. I'm also a very spiritual person, and I sometimes don't say this out loud as much, but I believe in God, and I just, for me, I also believe in the power of prayer, and I believe in um, the mercy of God, and I believe that He has been, watching over me throughout this entire process. And I also feel like this all happened for a reason, and it always does. And I think I see you and Mary, Pastor Rhonda and Mary, and I just see what cancer has done to you and where you're doing now as a result of having cancer, and how many people you've helped because of it. And so I just believe that there's a greater purpose, and sometimes it's not very obvious at the time, but it sort of unfolds. And I always think about what's the meaning, like, why did this happen? And, how can I continue to improve on who I am and what I do to help others? Because at the end of the day, we're all here actually because we all want to help others. Even before our cancer diagnoses, we wanted to help others, but it's sort of amplified by the fact that we also went through this horrible experience.
I'll add to that. I think for me, navigating through this cancer diagnosis and this journey really has taught me the importance of balancing like vulnerability with strength. So now I understand on a much deeper level the emotional and physical toll, that cancer can take, which has made me more compassionate. And I think about it more now about my research and patient care. And in terms of my professionally, for me, it's no longer just about research, because we can actually make a big difference in the lives of people like myself, right? So it's also make me think about, as a researcher, we can focus more on the patient-centered approaches, and to make sure like whatever we discover in the lab or in my data analysis, that can translate into like a real world prevention or treatment for those who are affected. So that's my take from my experience.
And when I was diagnosed, someone asked me, why you? My response was, why not me? I said, there's somebody that needs me over there in that world. And so that's the world that I need to be in so I could be of the help that I need to be. And this whole cancer journey, now mine has been, 23, 24 years now. There have been so many people that I have been able to help and touch, even when I didn't know I was touching them. And people have come back, I heard you talk, 10 years ago, and now I've been diagnosed and I remember almost everything you told us. So to continue to learn from the researchers, from the scientists, from other patients has definitely been a beneficial portion of my world since then.
I think I became very aware when I was diagnosed, and certainly when I was in treatment, of how many different really contrasting things in my life that I took for granted. Not just my health, which I'd always had really good health, but things like I have a very small family, and the ones that I have are kind of spread throughout the world, but I have several people here, and they took such good care of me. And I immediately started thinking, what if I didn't have that? I mean, you really need various kinds of support when you're going through really aggressive treatment, and it goes on, and you're not working, and you can barely get around. What if I didn't have that nuclear family there for me? And so I started looking at other people differently, and certainly I became more compassionate. And Wendy, you really touched on that, about how this adversity can create this compassion in you. But I started thinking, well, what if I didn't speak English and I had to navigate this really difficult healthcare environment? And it was tough, being a native English speaker. And what if I didn't have the resources? What if I weren't insured? One thing I didn't worry about, I had some insurance, right? So I could go to the place I chose and be seen there, and it was fine. What if I didn't have all these things? And I never really, okay, maybe peripherally, but I never really thought about it in this really profound way, that it just faced me right away. There's so many people, and I think that's part of it. And I'm sure Pastor Rhonda can relate to this too, because you help so many people. Um, um, that helping, people on a daily basis really helped make me feel better about that, because I wasn't feeling good about the fact about how hard it is to get through the healthcare system. And let's face it, you guys, it's a mess, right? And how do we make it easier for people? Because they need it. They need all the help they can get.
Yeah.
All right. Well, I would like to thank all of you for being our panelists, for being so open and honest and heartfelt. And now we're going to open it up to all of the attendees to be able to ask questions. And there have been a few questions that have been submitted throughout the time that you were all talking. So I'll ask the first one, and some of them might be geared a bit more specifically. But I'll ask the first one that Pastor Rhonda submitted. And this was to Bodour and Wendy. How can you encourage a researcher who has not been diagnosed with cancer?
You mean like to become an advocate?
To be more sensitive about the work that they're doing. But you talk about how you looked at it, Wendy specifically, how you looked at it prior to. And now that you've been diagnosed, you see it a little bit differently. So how can we help the researchers who have not been diagnosed to get a different bird's eye view? Can we?
I think the question is, how do we engage them to be more active in the community and to have more empathy? I mean, this is something that I know I
More
was
empathy for sure.
kind of doing already. Like I was already kind of it was very natural for me to kind of already do that, and maybe it's more heightened now. But I think one of the ways is to talk about what we do, right? Is to talk about what we do. It's kind of show and tell. It's sort of like bringing awareness to them. And we've actually had there was actually another cancer center that actually put together something exactly around this. Pastor Rhonda, I was actually leading that panel discussion, and of other researchers who are very engaged with their communities, to showcase it to their basic scientists. So putting together more programs, but also talking about it. And the idea was like, how do you teach basic scientists to be more involved with the community in general? And I think they need to be taught, they need to be shown how to do it, told that they can do it. They're not thinking that. Doesn't come natural for many people. And so it's not because they don't want to, it's just, you know, it just doesn't come. So they need to be taught. So I think that's how you do it. You show and tell, you teach, you lead by example on this.
I kind of love that you said that, Bodour, because I think what we're doing right now, sharing our personal stories, is incredibly powerful. And sometimes I think it's undervalued, like, oh, you know, it's another story. Everybody here, they're so inspiring. I mean, you know, overcoming, going through these transitions in your life, and that personal narrative. Yeah, I think maybe getting scientists and clinicians to listen and providing a platform for that to happen is really the challenge. But I really think the personal narrative is incredibly powerful.
So thank you. We do have a comment and question from our attendee, Barbara Kavanaugh. She wrote, I'm a cancer caregiver and found when my husband was diagnosed, the doctor always looked at my husband and wasn't listening or talking to me. He was a 33-year myeloma survivor, and I learned from him and other cancer caregivers and families that we needed to be heard. And she wrote that my question for all the panelists is she'd like to hear about your caregiver or caregivers and what their experience might have been like.
Well, Barbara's an expert in this topic because she's developing a cancer caregiver program, and she's been on the Bench with Bedside webinar series before presenting her program, and we'll send out some information again to everybody. But I think it's hard on cancer caregivers. That goes without saying. And I think cancer patients, because they're cancer patients, I think sometimes we forget how hard it might be on our caregivers. So I'm grateful to my caregivers. My primary caregiver was my mother. She was with me through the thick and thin of it. And I mean, it was very hard for her, and I will forever be grateful to her. I mean, I feel horrible that she had to go through that, actually. But my family was all there for me, so I'm truly grateful to family and a lot of good friends. Like Barbara was there along the way from day one.
So my mom was actually my caregiver, and she did everything from looking up what you should be eating as a cancer survivor to, and there was this one little thing we had about 12 almonds. I don't know what the connection was, but every day to chemo, it was 12 almonds. And I said, gee whiz, and I even had to count, she counted them out. I was like, oh my goodness.
Interesting.
So, so one day I'll have to find that out. But I am now her caregiver. My mom has been diagnosed with cancer, and we're in the fight for her life. And the things in 23 years, I thought I knew a lot until I had to be in that caregiver chair in a direct way. And to realize that I had to put on my boxing gloves. We talk about advocacy. I pulled the card, I pulled the cancer card. I had to tell her oncologist, you don't know who you're talking to. I am a cancer survivor. I am a community scientist. I am a patient navigator. I am a health educator, and I know. And this process that you're sending us through, where every 30 days was a different test. So you already know she's been diagnosed with breast cancer, and her CAT scan is 30 days away. And then you want to do an MRI, that's another 30 days. And then you want to do a PET scan, that's another 30 days. I said, there's one thing that I learned from Dr. Harold P. Freeman, is cancer does not kill, time does. How much of this would you take for your mother? And even better, how much of this would you take for yourself? What is it that we have to do to get her these tests that she needs in a timely fashion so that she can get what she needs while she still needs it? And he said the best thing is if she was in the hospital. I said, okay, well, we're on our way. I'm going to roll her in a wheelchair right around the corner. And I don't know what you have to do on your side, but you need to send the information over there so that we can get her in the hospital and get her what she needs. So when you're talking about as a caregiver, sometimes you have to say, excuse me. This is who I am. I am here as well. I am equally as important. When the patient can't care for themselves, I'm the one caring for them. I need to be informed. And if that the caregiver is not alone and it's a team, I had a hospital posse. My mom has a small hospital posse. We go to every appointment together. If that means somebody's on the phone or we're all in the room, you're going to have to talk to all of us because each one of us, we hear different, we remember different, but we're able to come together and agree on what finally go through all the clouds and agree on what did the doctor say? Oh yeah, you're right. That really is what they said. So as a caregiver, you have to fight for your rights as well. You have to fight for the fact that you're equally important and that you're not just the person that brought them to the doctor appointment. You're the one with them day and night, or days or nights or whatever. Every caregiver, every posse member has a role, whether it's somebody's taking care of the food, somebody's taking care of picking up medication, somebody's picking up the children. So whatever the role is, everybody has a role, and this team is a team of doctors that is helping us get through this journey, and it's a team of caregivers helping the patient get through on the other side. Amen.
That's amazing, Rhonda. Thank you for that.
Very.
Jennifer has her hand up.
Hi,
Jennifer.
and good morning still. I'll apologize for the road noise. I'm on the road, but I really appreciated this today. When I was first diagnosed, I had no idea how many kinds of breast cancer there were, that they had all these different attributes that really made everybody's breast cancer very, very unique to them. I thought it was, naively a disease. And I have invasive lobular cancer, and that's one of the ones that's not as prevalent certainly as ductal, and there's a organization that pushes specifically for lobular and facilitates lobular cancer research. So my question is, for you researchers, you're looking at different factors in your research. Do you also look at those factors against the types of cancer, or do you share any data or samples with other groups? I know the Lobular Breast Cancer Association talks about wanting to be very collaborative with other groups, and I'm just wondering, when it comes to the type of breast cancer, how does that, or how doesn't it affect your research?
I can speak to that. So Jennifer, as you're aware, majority of what we know about breast cancer comes from the most common one, the ER/PR positive, right? So like in my type of research, when we're dealing with not so common cancer, like the lobular, different subtypes, I'm also working in endometrial cancer, which also have very similar type, where certain subtypes of cancer have different prognosis and how it's treated. So the challenge that we have right now in terms of looking at this less common subtypes is we need to collaborate with other studies. So that's where all this consortium right now, they're, looking at lobular, we'll try to pull the data from, let's say, from Norris or from different cancer center, try to have that big enough studies so that we have sufficient statistical power in a way to be able to tell what risk factors that's different for these subtypes. what kind of treatment will be effective for these certain subtypes and how that will relate to prognosis. So yeah, so like in terms of what we do for cancer epidemiology, when we know there are subtypes in cancer, we try to look at risk factors specifically for that subtypes. With that caveat, we try to pull our data with other studies to make it bigger studies.
Yeah, and I'll add to that. So that's a really good question, Jennifer. And I think some of the times the difficulty also comes in the rare cancers, whether it's lobular, invasive lobular carcinoma or other types of rare cancers. Sometimes they're hard to study because of numbers, like Wendy was sort of alluding to. You don't have enough of them and you may have to go outside.
Right.
But the other thing is, depending on what you're doing and what your study question is in design, you may have to, in order to really so if you lump everything together, you also kind of lose information and you may not be as generalizable as you think. So initially, our study, for example, when we're looking for molecular markers of residual disease, right, which would predict recurrence, we did focus it just on invasive ductal carcinoma because because those samples that we started with were all invasive ductal carcinoma. It's hard to say, oh, this is also going to work for invasive lobular carcinoma because we know that they're histologically different, they're molecularly different, and I didn't want to make the assumption that they're the same. And so when you then want to validate findings that you discovered in invasive ductal carcinoma, it's hard to validate those findings in invasive lobular carcinoma because you're kind of
Right.
shooting yourself in the foot a little bit. I don't know if that's the right expression. However, it is sometimes still important to ask the question, is it generalizable? So that's what I've been doing a little bit more of now, and also true for ovarian cancer work that we're doing. And so in the current study, in this validation study of our markers of molecular residual disease, and also because of advocacy, I don't see her here from the Invasive Lobular Carcinoma Foundation. She's like, why are you leaving us out? Because the invasive lobular carcinoma patients it was actually an exclusion criteria in our study initially, but we opened it up. I decided that we're going to open it up to all types of breast cancer. We're going to ask the question of generalizability, but it'll also allow us to collect information on the different histological subtypes so we can then take those findings further if we have to. And in this type of study, be as inclusive, not just for population inclusivity, but also breast cancer subtype. And so it's sort of it's not all comers. You have to have exclusion and inclusion criteria, you have to. So there are things that are going to be excluded based on your study design because you want it to work. And so you
Right.
can't completely do catch-all, open it up, anybody comes in. Some designs will allow for that and it will be fine for some designs, but most designs you need inclusion and exclusion criteria and you have to have good rationale for it. So in our design now, we're validating work that, yes, started off with invasive ductal carcinoma, but we're expanding it because we're also collecting social determinants of health information. And although we may be limited in our power to be able to say a whole lot about invasive lobular carcinoma, we've started the process of at least collecting the data. I don't know if that
Right.
helps.
Yes, it does. And actually, I know that about your study because you were kind enough to tell me lots in the beginning about your design and things. But if I wasn't in your study, you wouldn't have my lobular sample because I was able to find a place for it. So I think, I'm glad and I understand, that you can't pick too much or you can't really get your study done, but I'm glad that that data is there. I guess my question is, it seems like there's a lot of data out there in the form of samples and data across a lot of different studies and institutions. And do you ever see an opportunity to get all that in one place and you can pick out what you want for data?
Yes. And that's when you have these biorepositories right? So,
Okay.
and data repositories, and there are so many of them out there. So if somebody has a question about invasive lobular carcinoma, they could probably go out there right now and all the tens of thousands of samples that have now been sequenced in various ways across the nation and even in other countries, where they can probably find data sets to like reanalyze somebody else's data set. So like in fact, I'm going to tell you right now in real time how many papers on invasive lobular carcinoma there are. So if I go into PubMed and I just search invasive lobular carcinoma, there are 5,383 hits. Okay, but let me
Yeah.
show you the difference. So I'm going to do the same thing for invasive ductal carcinoma. There are 32,554 hits.
Yep. Yep.
Right? But 5,000 is not a small number. So if I, wanted to find a data set that's specifically focused on, and I could probably go and see, okay, what was done and can I reanalyze this data set because I want to put a different spin on it or not? There are also these like networks that collect sequencing samples from breast cancer. So it could be breast cancer. And there are many of these where it's every kind of breast cancer and they just sequence it and they build this data repository for people to go. So the Cancer Genome Atlas, for example, the Orion Network, there are several of these now where there are like tens of thousands of cases that have been sequenced and it's publicly available data. So scientists can go in and like go and specifically look at whatever subtype that they might be interested in, and it'll be better than starting from scratch and trying to prospectively collect, right? You can go and access existing data.
Great. Thank you so much. And thank you for looking for ways to generalize your study, whether or not that turns out to be something you can do or not. And also not just assuming you can generalize. That's wonderful. But I think your study is just so fascinating about the environment and the epigenetics too. So anyway, thank you guys very much for today.
Thanks, Jennifer. I think Ruth, do you still have a question? I think I saw your hand up.
Yes, actually, it's more of a comment. I wanted to let Rhonda know that I had a similar experience as she did. My husband was diagnosed with lymphoma many, many years ago. And I'm a very intuitive person, and I noticed that there were changes in his health and all of the things that I was aware of that you should be doing something about. And I couldn't get him to go to doctors, and all the changes were there. And actually had heard when Jacqueline Onassis was diagnosed with lymphoma and they gave all the symptoms, I instantly knew that that's what he had. And he still wouldn't listen to me, still wouldn't go to the doctors. And finally, because as his health degenerated, he had to go to the doctors because he was by then in stage 4. I became his caretaker. Unfortunately, he was not receptive to my attentions because of the history. He had a very short recovery with treatment for about 11 months and then deteriorated and lost his life in less than 3 years. But because of my experience, it sensitized me to that. And I watched my health and I listened to what was going on about cancer and treatment, and had done a lot of research when he was not well. And so I've sort of followed the research as to what has happened. And I became aware that my health was deteriorating, and I started to have minor infections and urinary tract infections and diverticulitis things. And I'm going, there's something going on with me. I need to do this. And I was diligent about my mammograms, but it took about 2 years before they finally diagnosed me with breast cancer. And I had a very positive experience because all of that experience of having been a caretaker for him, not understanding what to do, but trying to stay in touch with medicine and that. But I I didn't need a caretaker. I was my caretaker, and I was very independent about it, and I've had a great recovery, and I'm 9 months cancer free now. But I follow all of you and all the research and what is going, but how are we getting that out to the public so someone doesn't have the experience that I had with a loved one or someone that they know that really should be seeking help, and you can't get them to reach out and take care of that illness?
Yeah, I mean, I think it's a collective approach. There's lots of different ways that we're getting it out. Mary, do you want to talk about that? Because I mean, I think your work really helps to do that as well.
Yeah, that's really a dilemma. And if I've learned one thing, it's how different we all are and how differently we respond to both our own diagnosis or the diagnosis of a loved one. So there is no one size fits all answer here, just because we're all so unique. Sidebar, my husband also received a cancer diagnosis, a serious one, about a year and a half ago. And it really opened my eyes to how this individual is responding to his cancer diagnosis as well. I mean, you learn so much about yourself when you're diagnosed, and then you learn a lot about the person, you're close to when they're diagnosed as well. In terms of inspiring others to take steps forward, what I find is, and my husband has found this too, if you find someone who actually can speak from firsthand experience on this particular topic. I was afraid of looking at this. I also had this diagnosis. That, for some reason, that takes down barriers, particularly for men, and no offense to any men on this meeting right now, but what I find over and over and over again is men resist support groups, sharing feelings. They'll go bond on the golf course, but in terms of sharing it's hard. And I think also it brings up a lot of feelings, a treacherous diagnosis like cancer. So I've seen over and over again, particularly men, but resist those steps forward. So I think it's individual. I wish I had just a formula, for that. But I have seen over and over again, firsthand experience breaks down barriers. There is,
And I've experienced that too, because I'm very open. I now have a niece who has been diagnosed with a non-specific type of cancer. She's being treated for it, but they don't really know where it came from. It's kind of an anomaly. I don't know. I've never heard of it. It's where she literally has breast cell cancer in her hip.
Interesting. Okay.
And so I work with her and trying to explain to her about, what my experience was. She, of course, it was her uncle who had the lymphoma, and so she's aware of his experience, but it's helping her through her journey. And I do try to do that with other people, but it just seems like sometimes it's really difficult to.
Yeah, let me plug, I mean, this might not be the platform for that, but let me plug this nonprofit that I've had, and my husband used them, and I've referred people to them over and over again. It's called Interim Angels, and maybe some of you are familiar. They're out of Chicago, but they're national. They have a database. I mean, at last count, the last time I heard, 27,000 people who had cancer who are in their database, but I think it's more than that now. And they do sort of a light training of these people who become mentors. And it's like Match.com for cancer patients. You call it, or you sign up or whatever, and you enter your information, and they'll match you up with someone who's same age, same gender, same diagnosis, but ahead of you. And so you can ask them the questions about, well, I'm going into CAR T-cell therapy. What was that like for you? And et cetera, right? So it's called Interim Angels. Write that down. And people come back to me and tell me it's amazing. My husband met a guy who had the identical diagnosis, slightly ahead of him in treatment, who was in North Carolina. And of course, they met on Zoom over and over, and they never would have met otherwise,
Excellent.
And if you have a rare cancer, it's even tougher, because where are you going to meet that person?
Mary,
Right.
can you
I think I can refer her to that, and that might help her, because she's totally confused. She's working with the City of Hope. They would like to take her, but they apparently deal with very specific types of cancer. But it's so odd and nebulous that, it's hard to get a handle on it. So I've written that down, and I'll refer her to them.
Right.
So one thing that you might want to look into, what you've described is primary cancer of unknown origin. And so you want to do a little bit of searching around those terms, because that's a very rare situation, but it does happen. Because it sounds like that's maybe what she's dealing with, and that might help you also get to an expert.
I want to help her out because I see how she's struggling. And I had a very specific type of cancer, and it was early detection, which is marvelous. And I had a fabulous surgeon and oncologist. And I appreciate all of your information and the things and I'm doing the things that you're telling me to do. I'm staying involved, watching what I eat, looking at what I'm putting in my systems, staying active, and it's working.
That's
And
great, Ruth.
I'm expecting to live to be decades older than I am now, and I'm close to my 8th decade, so I'm looking
Way to
forward
go,
to
Ruth.
getting more. But I'll refer her to that information and continue to monitor your program and get more information for others.
Thank you. That's wonderful. And I wanted to ask Barbara, do you have anything you want to add on anything that you've heard? And thank you for joining us today.
I don't know if you're able to hear me because
Yes.
okay, good. I think this is so wonderful. Really, I sit here and I listen to all of you, and what I realize is that the path I took, which as Bodour knows, is I was one of these people that when my husband was diagnosed, I decided I had to do something about it. And that was he was diagnosed in 1991 with multiple myeloma, which I knew nothing about. Even though I'm a therapist and I knew about some cancers, I had never heard of that. But anyway, I became very proactive and got very involved. I took notes when we went to the doctor. I asked questions because he was a guy, and I was laughing, when Mary was talking about her husband. It is harder for men, to talk about their feelings, and I'll make that generalization because it happens to be true. And that's why, there are 6 women on this now. Isn't that interesting? I mean, but the point is, one of the things I also learned was how important it was for me to learn about the research and to be able to then translate that for people who didn't have that either access or didn't feel they had the right to ask a doctor. I mean, you don't say to the doctor, well, what is it and what's going to happen and what are the side effects? And so that's how I worked. I mean, I started with Arizona Myeloma Network, but I added the cancer caregiver, a workshop where I would, meet, during a conference I was putting on annually, and I found that a lot of the caregivers were men and women, of course, and sometimes it was the young adult, almost a child in the family, who was the one that had to take care of a family member. And so I developed the program, but what it really was based on is really connecting people. And I think what you're hearing is a number of ways that all of you have. And Bodour knows I would never wish it on anyone, but for a lot of researchers, they're in their space, they're in their kind of space, and somehow hearing the patient. So what I'm saying is really wonderful that this kind of dialogue is going on. And I'm, and again, I'm always, realizing as I, listen to each of you bringing different, experiences, also different ideas, is that we really need to have much more collaboration among the institutions, among the research, among the there are a lot of quote resources out there. But again, I used to find I would invite all kinds of other groups to come to our conferences because my motto was, everyone, no one can do everything, but everyone can do something. And that has always been, and I'm very much like you. A couple of you have commented, and I really have, a lot of faith because I was Jewish, my husband was Catholic, and we used to always laugh about the way different cultures deal with things. I was oy vey, and he was, come on, let's go out and have a drink. And bless his heart, it was a great combination. But anyhow, and when I did lose him, it was to an aneurysm. And I always say that to people, is sometimes the side effects are much more extensive than you realize. He had a cardio condition, but also there were certain things that medications that I think aggravated, his neurological aspects. So again, it's so good to be not only informed, but to share resources. And I always used to say also, there's plenty of cancer for everybody. So you don't have to worry about competing for it. And that's kind of been my philosophy. And it was really great with Bodour. She had her wonderful Egyptian mother, and she also had a Jewish mother. So the two of us, we might not have been able to understand each other in language, but we both loved this girl. So it was, and that's part of it too. We've been overcome a lot of the cultural differences by working with the family. We've worked now with the Navajo Nation. We work with other groups and cultures. And a lot of it was more about the family. They had to be included. And if they weren't, they didn't know what to do. And they felt really, and the whole thing about clinical trials. We did a workshop, and we still do it, about what is a clinical trial. I mean, the average person doesn't really know. And I mean, and what you're all talking about is so great, because all of you have reached out in different ways to kind of bridge that gap. So Annie, God bless you all, and thank you for including me. And I'm certainly hoping to talk with you all again, and in any way I can be helpful. Bodour will share my information. Someone said to me or something about if I was going to retire now that my husband was gone. I said, you know what? I said, I don't even know what the word retire means. I'm like you. I'm in my, I won't even mention how many decades. But again, part of, for me, of what I have found in life is the kind of meaning you can have to not only to your own family, but to others, is such an important, I call it my aphrodisiac. That really is so important. And so I hope to see you all again, and anything you ever need or want, we have a program that is, obviously when it's online, it makes it national and even international, but we always want to add to what we're offering, and and be able to keep helping people help each other. God bless.
Thank you, Barbara, for that. It's so nice to have you here, and all of you. And I just want to thank everybody for being here today, and for the panelists. And actually, I'll let Dayanara and Audrey close it. But before I let them do that, I want to thank them so much for putting this panel together and coming up with the questions and leading the conversation. You guys both did an amazing job, and I think you drew out all of our emotions and feelings and thoughts on a very serious thing. So kudos to both of you, and for all the help that you're doing with the program.
Yeah, thank you. So with that, we can close this session out. We're very excited for our Komen Walk next weekend, next Saturday, if you're local in Los Angeles. We'll have a table with our clinicians, and we have a team, we have shirts and lots of goodies for everyone. So if you're local, please do join us. And with that, Diana, do you have anything?
I would also just like to add, keep a lookout for your emails. We're gonna have another surprise or two during the month of Breast Cancer Awareness Month. So keep a lookout on your emails, and we can't wait to share more when we can.
Amazing. Yeah. And we hope to see you at also at the very least at our next monthly webinar.
Yeah. Thank you, everyone.
Everybody have a great weekend.
Thank
Bye.
you.
Bye.